He can tell you his title because it's a bit of a mouthful and all the things that he covers as well. I don't know how he puts that on a business card, but he's a very busy man in that space. And we'll be talking to Mark today about the Build Back Better program that he's been leading on around COVID, through COVID actually. A huge amount of work's gone on with Mark and his teams in the COVID space. And then some of the exciting things and projects and schemes, etc., that they're hoping to deliver post-COVID, although some of those have even started now, whatever post-COVID means. So, Mark, do you want to introduce yourself?
Yeah, thanks, Kirk. So I'm Associate Director of Public Engagement at DMU, and it is quite a broad portfolio, as you said, and I do get to get involved with lots of things. And recently I've been really involved in looking at how we recover from the pandemic as a city. And I think it's quite a unique thing to be working in a university during this time, because it enables people like me and the academic community at the university to actually take a step back and think about what we can be doing, rather than having to survive day to day and put out fires everywhere. So it's been quite an interesting time for us, and we've been able to come up with some good innovations, I think, that would enable the city to recover in a more resilient fashion.
Yeah, some really good stuff. And I know, obviously, firsthand of some of the things you're doing. I think it was really important for our communities, the Muslim community particularly, that tune into this radio station to hear some of those things, because the city does have its challenges, doesn't it?
It absolutely does. And the part of the modelling that I used, or the exact modelling that I used for the Build Back Better programme that the universities focus on, actually acknowledges not just to build back better, but actually acknowledges that in the first place things weren't that great in many communities across the city. And I don't mean that we haven't got great communities who care about each other, because we have, but we have lots of communities that live with some fairly serious challenges around deprivation, low income, homelessness, health issues. And what we've taken is a United Nations model of disaster recovery, which was first used in Japan after the tsunami in 2011, and how they recovered from that. And the immediate thing was that, like so many places, Japan and the small islands that were affected by that tsunami had their own challenges to address. And fundamental to the model is actually communities working together, so that people understand that, are able to say, look, we live in these communities. We've been saying for years you should do things like this, and then provide the solutions, and then work with large institutions like universities or the city council or the NHS to actually build out a new way of working and a new way of thinking. And that's what our model provides. And we've started to develop different kinds of methods. Some of the things at the moment are reactive to the challenges we face in COVID. So digital divide, for example, is something that is really significant at the moment, particularly in Leicester, where we have lots of people who aren't connected to Wi-Fi and aren't, or don't have the financial resource to buy the appropriate kit to work from home and things like that. So there is some reactive stuff, but we need to also look to the future. How are we going to ensure people are connected to Wi-Fi long term? It's becoming something of I like to use Wi-Fi as an example because it's almost like a basic human right now, like electricity and water. It's
like a given, isn't it? If you haven't got Wi-Fi, then what's going on in the world? I couldn't imagine some kids without Wi-Fi nowadays. The amount of time their phones are glued to the palms of their hands.
The first thing you get asked for, isn't it? What's your Wi-Fi password?
Exactly. Anybody walks into your house now, cousins, whatever.
Used to be,
not now, but previously put out the lockdown. Yeah. What's the Wi-Fi password, please? Bloody hell, you've not even said hello yet. But anyway, DMU population is got, obviously it's a massive footprint now in the city centre. I mean, the development of DMU over the past couple of years has been huge, and lots of people from the Muslim community attend DMU. You know, I see it on a daily basis when I'm in town, and the amount of people that are from Leicester and out of town as well. How are we going to be able to contribute? The students from your population and the communities around the city, how are they going to be able to contribute to this type of programme going forward?
Yeah, well, I suppose I should start by saying that our Muslim community at the university is incredible. There's 3,000 users of our prayer room every week in not in lockdown time, of course, but wow. Outside of lockdown, we had such an amazing, vibrant community, and Friday prayers were often responsive to the challenges that we were actually working on. I actually my office sits above the prayer rooms. It's really quite well placed to have a good relationship with the Imam, Mohammed Laher. And he would often come up and say, well, what are you doing? What are you working on? And we'd say, well, we're doing some outreach for homeless people this week, or we're looking at some issues in India. And they would base their Friday prayers around those activities and support us not only with volunteering activity, but they would do fundraising activities as well, and actually help us to mobilise a few things. So I certainly wouldn't understate the Muslim community at DMU, because it's such a integral part of the university, and the university's identity is one of diversity that reflects the city. And so I think that's something where we are proud of as a university, and I think the Muslim community in Leicester are very proud of its association with the university as well. And it's certainly because we've got high student numbers with high diversity and a willingness to do things, it really is a positive enabler to actually getting some of this stuff done. So when I do go back to the student community or the academic community and say, right, we're going to try and support people who are suffering digital divide in the city, people say, yeah, okay, let's give it a go, you know, rather than say, sorry, who are you? So it's really nice to have that relationship.
The student population at DMU is, how much is it?
The total number is 25,000.
Wow.
And obviously we haven't had 25,000 on campus for quite a while now, yeah. But it's when politicians campaign, they like to come to our campus because it's like entering a small market town because there are so many people around.
That might be a tip, actually, Mark. I've never thought.
Yeah,
there probably was a reason why you've come on now. You've given me a good tip there. But you're kind of renowned in the city, and obviously you mentioned the United Nations, and you're following these models, and you're the lead here in the city for delivering the sustainable goals, United Nations Charter, etc., etc. There's a lot of voluntary organisations in the Muslim community that are doing some great work and whatever. You know, the way that you do things and have built up that expertise around creating opportunities, innovative ideas, and etc. What kind of tips could you give to the groups that are out there now that are looking at how they're going to survive possibly post-COVID, how they've had to change the way they deliver their programs and their interventions and all the things that they've been doing forever that's all of a sudden just gone out of the window? How can they use some of your kind of expertise and tips of remodeling yourself and being able to get things done?
Well, firstly, I'd always be willing to share my ideas with people and listen to their ideas and look for potential collaborations that way. And I think basically the model that or the way of working that I have is kind of to try and be bold and innovative and constantly trying something new, because every now and again you can try something new and it really will work and it will work well. And I think the COVID time is a time to try something new. I think it exposed not just the prevalence of the pandemic in the city, but actually nationally. It exposed that things there'd been a simmering undercurrent of failure in the United Kingdom for some time in terms of how we've treated certain communities and how we've relied on groups. So some of the NGOs that you would be referring to are actually doing incredible work, but they're taken for granted. And now it's time for those groups to say, we're really important to the city and we're really important to our communities and to be recognised as such. So I think there's real space for innovation now. And I think everybody has to do things differently. The way we teach our students at the university has changed, and we'll probably never go back to how it was prior to the pandemic. And I think that's how you've got to look at your NGO models now. I think what charities and organisations have at the moment is an absolute respect from leadership, governance, and some of the key players in the city, because when the pandemic was at its peak, I think the city would have absolutely collapsed without support of different charities and organisations coming to the aid of others. And 100%. I know that within that, the Islamic community actually were amongst the first to really get organised and to start delivering food parcels to people and start addressing areas of the city that were not as well connected and organised as other areas. So I think there's something around that really, that this is a time to. I think there's a momentum around the importance of charities and community groups, and now's the time to, if you're going to innovate, do it now while you've got everybody's eyes and ears.
Yes, everybody's listening. This is the opportunity, absolutely. Hassan?
I wanted to ask a question, Mark, not the risk of putting you on the spot, but you are on the spot, so I've got to ask. How do you assess the reach of the program? And in terms of the aims and objectives, how well it's performing, or where there could be any potential for improvement? How do you guys do that?
Yeah, well, one of the things that the university is very good at on two levels is evaluating things and researching things. So sometimes we address the reach by actually studying what happened and trying to assess what went on when a certain output was delivered. But then there's some, I find it quite boring, but some of my colleagues are really into it. Like they're almost, these situations are project managed. So from the start, they come up with an idea that say we want to teach 20 homeless people employability skills or something in the next 12 months. So they know they've got a time scale, they've got a number, they've got a method to do it, and then they kind of map it against certain project management statuses so that they know if they're on track, and then they use their own evaluation methods. So I guess that I'm fortunate in a way because I can utilize those tools that we have in the university, the sort of project management tools. Or if we think there's something really unusual going on and we can't really explain it, that's where we can sort of enlist some researchers to really get amongst the data and find out exactly what happened. But
just to follow on from that, Mark, just so people are aware of the scale of the program that will be rolled out and the scale of the work that's gone in to get it to this point. So working, I guess, where we are now backwards, there's 30 recommendations that have come out of hundreds. There was a whole range of workshops that were hosted with community groups, academics, business sector. Who else is on that list?
Yeah, so we had charities and organisations, local businesses, which ranged from sole traders and very small businesses up to multi-million-pound global concerns. We had 70 academics, we had 60 charity organisations, and we had a public consultation by the Leicester Mercury and Radio Leicester. So so we had a fairly broad consultation in that regard, and that's fundamental to. I spoke earlier about the United Nations Build Back Better model. That the actual consultation is the most crucial part, really, because it's getting people to understand what people's concerns are, and we ended up with 30 recommendations agreed upon from over 300. But the important thing about that was that people were repeatedly saying these within the 300 recommendations. They were kind of endorsing the same ideas in a way.
Yeah. That I get the consultation is key, and I think it's, I guess as well, something for us as a community to learn from some of these bigger models that, like, your institutes, your academic institutes are taking on board, and whatever consultation, listening to the community, listening to those that are going to be your end users, those that will use the services that you're trying to provide, and so on and so on. Because if you don't, it's like, we're sitting in rooms writing policy and strategy on behalf of thousands or tens of thousands or hundreds of thousands of people, but we're not communicating with them. And then when it lands, we're just saying, well, we know best, kind of thing. And I'm an absolute firm believer that is the wrong way to do things. So the consultation, 70 academics in a room looking at a community initiative, that's got to be a first, hasn't it? 70 academics in one room. How did you manage that?
To be honest, I think that's why the university really got behind it, because like the university looked at me to come up with these ideas, and I've come up with lots of different things over the years, and usually I get like a handful of people get behind it, and then it's a nice project to do. But as soon as word got to our executive board that 70 academics had turned up to help me with this, they were immediately like, "This is a serious project." Like, they were, let's sort of harness this community of academics and support them to get some stuff going. So that immediately sort of won the backing of the university, whereas in the past I perhaps have had to gone cap in hand to the executives and said, "Look, I'm doing this thing. It's a bit of a crazy idea, but I think it's going to have some good outcomes," and so on. But this was completely different. It was like they were coming to me saying, "Could we be part of this? This seems like quite a big deal," So it's quite a nice thing.
It's almost unheard of.
It is, well, definitely.
When it was being shaped, I mean, when were we talking, Mark? Just after the COVID started, wasn't it, in March last year? And we were having discussions. I don't know where Mark was, but I was in my kitchen walking around on the phone for hours talking to Mark about what we're going to do, because we have these conversations. We're both kind of blue sky thinkers, so we connect well on that level of innovative stuff and whatever. And we was like, we need to do something. This is, how do we bring people together? What's going to happen in 6 months? At that point, we was talking about 6 months, weren't we? We never envisioned it was going to be 14, 15, 16 months later.
Yeah, that's like one of the shames, really, of the consultation went so well, but everybody at that time was talking about, well, in December 2020, when we're out of this, we need to start thinking about the provision of employment for young people, and we're still really yet to start unpicking those problems, and that's so I think where we were talking about ideas for 6 months' time and building a recovery from that point, we're actually talking about 18 months. And I think the important thing is the themes and the problems will unfortunately still be there, but in some ways it just feels like we've lost some time. And I know, well, I think we all feel like that because we've had to stay at home for great lengths of time, and we've had to not do the things that we all wanted to do. But so it's been deeply frustrating on that.
Yeah, well, we as a community arrived at the first easement of lockdown and went into a Ramzan lockdown. So we've still got a period of time to go before any kind of lockdown restrictions apply to our community. Just on the challenges perspective, Mark, obviously, as you said, there was hundreds of people that was part of this consultation, and coming up with the 30 recommendations, what were the kind of key recommendations in regards to what are the challenges going to be for our city coming out of this, and the ones that are particularly be pertinent to our community? Because I want our community to hear that we have got challenges, we are on a journey, and we've got a way to go with this, and it's going to take, you know, kind of all hands to the pump scenarios to be able to try and work our way through this. You know, we're coming out of some physical restrictions in terms of lockdowns, but there's still some massive things to overcome.
Yeah, well, I mean, I mentioned earlier about the digital divide, and that's definitely one. But I think there's something that's pertinent to the diverse communities of Leicester is that some communities do get left behind, and that's a reality. That because of their ethnicity, they are left behind in school, in how they're taught in schools, and how other communities see them and things like that. So there's some big challenges to kind of address to ensure that everyone benefits from the recovery, and it doesn't become a situation where those who are able to connect with the recovery process recover, but those who don't, because they're marginalised or excluded for whatever reason, already get left behind. Yeah. So I think there's a fundamental that we need to, when we really get into this, make sure that everybody is connecting and benefiting to this. And I think there are some challenges around languages in Leicester. I think that's been an issue that's certainly been fed back to me by local NHS workers who said when they went into some communities in the city, they couldn't access the literature around how to stay safe during COVID, and they were suspecting that was causing some of the spikes.
We've got a minute left, Mark. How can our communities connect and support this program going forward, or how do you need us to kind of be involved in this so that we can make sure that our communities are not left behind in any way?
Well, the easiest thing to do would be to reach out to me in the first instance. I don't say it with any arrogance, and I'm not inviting 30,000 emails, but I do really enjoy engaging with different organisations and hearing their ideas and bringing people together. So my email's mcharlton@dmu.ac.uk, and people are very welcome to share any ideas with me on that, or actually just criticise the things that I've said. I'm very happy for that as well. I haven't got all the answers.
Well, I was going to say that's an unusual trait that innovators have, is, you know, people that are kind of blue sky thinking. They don't mind the criticism because there's always going to be people that don't understand the vision, and there's nothing wrong with that. You know, it's just trying to make things happen.
Yeah.
Mark, thank you so much for coming on today. I really appreciate your time on a Friday evening, and thank you. And anybody that needs to reach out, please do so. We'll see you on the other side of the break.
Thank you.
radio show on Ramadan Radio 87.9. There's me, Kirk Master, and my co-host sitting here with
Assalamu
me,
alaikum, Hassan Salman.
all socially distanced and all the rest of it. The second part of the show, I'm really pleased, again, as we said, and we've been discussing getting some community groups on and people that are doing some fantastic work in our communities, for our communities. And this group, I think, is exceptional beyond belief in terms of what they do and how they do it, for no other reason than the impact that the situation of their volunteering service has on the families at that immediate time, and how they just stand up and just get on with a whole range of things. But I'm going to let them do their bit. I'm going to introduce the first person, Ahmed Kasu, who's the project lead program coordinator for the Leicester Muslim COVID-19 funeral support group. Surely you could have found an acronym for that, or a shorter title, of all the talent you've got in that organisation. And then we could have done 2 volunteers. We've got Nafisa and Imran, who I'm sure will be fielding most of the questions, because Kasu is very good at delegating. So Kasu, just take us back to the start of COVID-19 kicking in. A whole range of different things started to happen in and around the Muslim community relating to the death of people, funeral needs, ghusl needs, hospital transportation needs, etc., etc. And what triggered in your head and the people around you to take you to where you are today?
Okay, so I think go back to 23rd of March last year, when the first meeting took place. Or prior to that, actually, there was a meeting for masajids, and there was a discussion. The doctors were there and the specialists were there, and they were giving us figures of the number of deaths that they were predicting in Leicester in the Muslim community, and it was a high number. So after that, I spoke to some of the brothers in the funeral arena to say, what have we got in place? What have we done? And nobody knew what to do or what to expect. So we then arranged a meeting with some doctors, some of the specialists in that field of COVID who were there at the first meeting for the masjids, and then we had to bring a few more people on who are involved in the funeral arena to say, we're going to have to tackle this together. We're going to have to work together to do something about this. And we got a few professionals, few community leaders around. It wasn't the table, it was around a Zoom meeting, and that's how it started. And then there was a call put out to say, we're going to need volunteers. This is not something that one group or one entity as an individual is going to be able to tackle or take on. And we're going to need volunteers to assist with picking up bodies from the mortuary, from the hospitals, from homes. We're going to need volunteers to do the ghusl. We're going to need volunteers at the cemetery. And a call was put out to say, we need volunteers. And alhamdulillah, what I can say is within 3 days, we had an amazing response. 250 people had signed up online to volunteer their services, both male and female. And I think we had about 100 sisters.
In a 3-day period, 250 volunteers had signed up. And they didn't even know at that point, technically, what they were signing up to do, other than just help.
Just all they knew is that they needed to help with ghusl.
Wow. And
at the cemetery, nothing else. I mean, what it entailed, PPE or any of these things, we didn't even know what PPE was at the time. That's all it was.
That is unbelievable. Nafisa, how did you get involved in this?
Assalamu alaikum. So the first I heard about it was a text message that one of my cousins had sent on to us. We'd never participated. We'd participated in a couple of family ghusls, but nothing, outside of that. But it was just a calling from the community, really. We didn't know what we were getting ourselves into at that point, but we just thought we'll sign up and then just see, where we go from there. The main thing was, I think with a lot of volunteers, was they just wanted to be of service during a point where we didn't know what was going to happen in the future, or how many deaths to expect or anything like that. But got in touch, and then we filled in a questionnaire, and it just went from there. They were so organized. Ahmed Bhai, really organized. We had our PPE training online. Everything was online through videos and Zoom calls, and started from there. And a year
What's
later,
what's your
alhamdulillah.
role? What's your role now?
So I still go and help with the ghusls,
Okay.
and uh, I'm not a team leader, so we have team leaders that come in as well. I'm still just a volunteer that helps with the ghusls, but help the new beginners come in who are starting to join as well, guide them a little bit as well, you know, in confidence, and help them just feel their way through PPE and things like that, bits and pieces, because we've kind of developed as we've gone along throughout the year. We've learned how to put on our PPE and, you know, what kind of steps to take. With people who are new to the group, who are joining, they just need that little bit of help and a little bit of a confidence boost. But everyone works as a team, so, you know, no one's really got a set role other than the team leader. Everyone just pitches in and does the ghusl, really.
Yeah, no, that's brilliant. And Imran, how did you get involved in this?
Similar to the sister, Ahmed shared a message asking for volunteers, and I just signed up. You know, we always have an opinion, but this was an opportunity to get involved and give something back to the community, and that's how I got involved. And everything else, Sister Nafisa sort of covered. You know, the PPE training, etc.
And your groups, obviously, that's a huge number of volunteers, and obviously you've worked out, you know, who will be attending what because of COVID numbers and so on and so on. Mm-hmm. How do you facilitate all of that? You know, that's a job in itself, isn't it?
Brother Ahmed's being humble here, but he's a magic behind.
So
the
basically, we have a team. We have a team of call handlers who take a call from a family maybe who's lost someone. So they'll be put in touch with the call handlers. The call handlers will then get in touch with myself to say, you know, we've had this death. It's a COVID death. We need to arrange pickup from the mortuary, and then we have a transport team. I think there's about 15 to 20 in there. So we'll put a message on we have a WhatsApp group just for them, and we'll put a message out to say we need 2 brothers or 3 brothers to pick up a body from the hospital or from the house, wherever it may be, who's ready. And alhamdulillah, you know, we always have people who will respond, and then we'll look at who went yesterday, who went the day before, you know, and we'll just like say, okay, yeah, you know, these lot are next in line, or this person's next in line, and they'll pick up the body, they'll liaise with the masjids, central mosque. They've played mashallah a really good central role in providing their transport facilities. Same with Jami Masjid, they've provided, you know, the masjid facilities, the transport facility. They pick up the van, go to the hospital, pick up the body and bring it back to the place where we actually carry out the ghusl, the bathing. So that's the first step. And then whilst that's taking place, at the same time, we're sending a message out, whether it's on the sisters group. So we have a sisters lead group, and we have a coordinator on there, Sister Khadija, who will send a message, and then she'll put it out that we need a lead. So there'll be one lead chosen from a group of 10 sisters. And again, it's taken in turns. And then we have another separate group, which is assistants. And then she'll put a message out on there that we need, 5 or 6, whatever it may be, sisters to assist with the ghusl. And again, same, you know, you'll have, a huge response always. And then she has her job then to coordinate, get the sisters there. And we do the same on the men's side. We put the message out. You know, we've got, I think, 100 volunteers on the men's side. And same, the brothers will respond. You know, nobody asks who's ghusl. You know, they'll just say, yeah, I'm ready. And same, we have a brother, mashallah, who's taken over that role, taken that that pressure away from me, and who now coordinates the ghusl. So he will arrange, these brothers come. We'll always have 1 or 2 who we class as senior, who will lead the ghusl, and then we'll have 2 brothers or 3 brothers who know how to do it but not very senior. And then we'll always have one person on both the men and the ladies' side, who will be somebody who's new, who's just maybe joined, you know, who came as to the funeral as because somebody in their family or friend had passed away, and they'd say, oh, I'd like to take part, I'd like to, join. So then they will observe. So they'll observe 1 or 2 ghusls. Once they've observed 1 or 2 ghusls, then they put on the table, and it's basically practical on-the-job training. And there's always, I don't really take part in the ghusls. I have done, but I mean, Imran and Nafisa are the ones who will tell you how they deal with people who are new and how they assist them, to give them that on-the-job training.
Yeah, as I said, when I asked the question, it sounds like a full-time job in itself, and the way that you've produced this kind of process to make things simple at every stage is yeah.
It's unreal just listening to you, Ahmed Bhai, and obviously Nafisa and Imran as well, that the scale of the operation that you're describing, and I know the radio station has afforded you a few minutes each just to speak about it, but it's on such a huge scale. I think, in future days, it'll be something as a case study that somebody would look at. This operation that you guys have put together with a great team of volunteers, alhamdulillah, is unreal. And I've seen the videos and promotional stuff and conversations, but the kind of vast examples you guys have provided, I think it should be mirrored and copied from other places as well. I'm surprised. Have you heard anything from other cities where this is probably taking place?
Well, as a team in Leicester, we've had to facilitate ghusls for other cities because they weren't carrying out the COVID ghusls. So they would get in touch with us saying, look, we've had a death. Can you assist? Yes, no problem. So they would drive the body down to here. And, again, same, the team would get ready, give the ghusl, and then it would be taken back to their city. One of the cities, alhamdulillah, are for both the sisters and the brothers, Northampton, no ghusl was taking place, COVID ghusls. So we then liaise with the imams and the medics there, and we arranged training for the sisters and for the brothers, and alhamdulillah, they are now carrying out ghusls in their own city, for COVID. So it was just a bit of being there for them, guiding them, showing them the way. And the team that went down, it wasn't myself that went down, it was a group of brothers and sisters who went down, and they delivered the training, and amazing feedback they've had from there as well.
This whole kind of somebody passing away in a family, a loved one, your friend, it's very emotive and quite emotional and an upsetting time. The role that you all play must take away a lot of that burden from the families and make it, more tolerable in that moment for them. Nafisa, is that what you've been finding? Because I guess it helps enormously.
Yeah, we've had family members who have, when we've gone in to give the ghusls, they've been maybe waiting outside, and or sometimes, the family members actually just say that it's such a comfort. When it initially started, people were so scared that their loved ones wouldn't even have a ghusl. Yeah. So because there was so much, hype and information going around, that they were just so grateful. But alhamdulillah, it's such an humbling experience, because before COVID, I always took it for granted, ghusls, that there would be an elder somewhere in the community who'd be ready to give a ghusl, didn't think enough of it, that all the elders would be actually taken out of the equation, and it would be left with the next generation of the younger people to take over. And so, it brings a lot of comfort to the families to know that, the younger generation or the youngsters have stepped in and actually taken over this role. And it's across the board. I mean, within the ladies group, so many people have joined from so many different arenas, different professions, different, just to be of service. But the feedback from the families have been fantastic. It is such a source of comfort for them to know that their loved one has been taken care of in a very dignified manner, in an Islamic and dignified manner, it helps them. It helps the grieving process as well, to know.
Absolutely.
That,
stuff.
Definitely. The feedback's been brilliant.
Imran, from your perspective, the emotional side of things, obviously we're talking about the family's emotion, which is paramount at that point, but also for you as volunteers, how do you kind of keep yourselves motivated and have that kind of camaraderie between your own groups to keep that level of commitment there, and also to deal with some of the emotions that you'll be going through as volunteers as well, because this is serious stuff. This is serious stuff that you're dealing with on a daily basis. How do you manage with that?
I think at the start it was challenging when this was all new to us. The other part to it is volunteers. Some people we haven't met before, we've got to know through the process. There is that camaraderie. We've built friendships as well. What has helped is there's no greater or lesser person in that volunteer group as well, whether it's for the ghusls or the burials. Like Sister Nafis said, people from diverse backgrounds, different ethnicities, businessmen, professionals, medics, simple people, might work in a factory as well, or even a taxi driver, for example. But we've all come together. We work with each other. We talk and coach our way through even the ghusl process, for example. There'll be a group of 4 or 5 people. Like Ahmed said, somebody could be new, somebody's more experienced, but there's nobody, to make you feel lesser or greater. Everyone's got a role to play. We talk each other through what we're doing. At the end of the day, the bottom line is it's another Muslim who's leaving this world. It's the final rights, Islamic rights. We have to get that right. And ultimately, someday it's going to be our turn as well, and somebody's going to have to go through that same process and ritual with us. So yes, it is challenging, but something to remember is we have to be compassionate towards the family as well. The emotions they're going through. They're on the spot. There's all sorts of stuff going through. Like Sister Nafisa said, there might be an element of fear. They don't know whether they'll be able to see the face of the deceased, whether they'll be able to get involved with the process at the burial. So, for example, at the burial, during burial, as things went, progressed and we learnt more, we got better at what we were doing, engaging with the family, getting them to get involved, obviously with COVID guidelines in place as well, turning the body inside the coffin box, to the right-hand side, lowering the coffin. Some people have never done that before. And because it's minimal people, the volunteers were able to, guide and advise and help them through the processes.
Just going forward, or even not even going forward, what's been the community response and the family's response been like to you on site in the different places, from the hospitals to the collections, either at home hospitals, at the cemetery? Has the community been, kind of abiding by the way that you're saying that things need to be done because of the COVID stuff? Have they been compliant? How has it been for them and for you in having those conversations?
Alhamdulillah, I'd say in the majority, we've had no issues. Everyone's been compliant. They've, it was something new to everyone. In a Muslim funeral, normally, at the burial, you normally have like 200, 300, 400 people attending. And all of a sudden, initially when COVID kicked in, it was only 15. Only 15 people were allowed to attend. And as somebody like myself and the team, we have to inform the family that only 15 can come. And, we'd have to be like, people would think we're policemen. We're not policing, we're just trying to abide by the guidelines. And we've seen, in the media, when we've not been abiding by the guidelines, and when 100 or 150 people turned up, we were on the front pages of the newspapers. And the last thing, that's the last thing that we wanted. So, 15 people, it then increased to 30. You have limited, people who can attend. And the volunteers, I'm not sure whether it's come across to everyone, but I think the majority have understood, and they've come back and said, Jazakallah. I've had somebody put money through my letterbox. If we had taken the amount of donations that have been offered to us as a voluntary group, for our volunteers, some of us would be, having some really nice cars or whatever else we wanted. We've been offered whatever we have wanted. We've been offered funeral hearses to say, we'll buy you a hearse, we'll buy you whatever you need. And alhamdulillah, we can say that to date, we haven't taken a penny off anybody. We've said to people, if you want to give us anything, give us your du'as, that we as volunteers can stay safe, so that we can carry on doing this work, make dua for our volunteers. That's all we've wanted.
Kasso, I've got a message here from somebody who said that she works in the hospitals and has given many people their last wash, and she'd like to know how to get involved to do the community ghusl. How do people get involved if there's opportunities to get involved? Because I'm sure there's a number that will hear this and say, do you know what, that's something I think I'd like to be involved in, or I'd like to give. something back? How do people do that?
Very, very simply, if they get in touch with the radio station will have my details and they can pass that on. I'm not going to give my number. Normally, I do just tell people pass my number on, but I'm not going to give that over this particular platform, which can go worldwide. So, but I just want to say, you know, Kirk, this has been a community initiative. This has been people who have come together from all sorts. Even if we look at just our Ghusl facility, we've had, you know, people, the plumbers come in to connect up the boiler, install water provision. We've had carpenters, electricians. We've had a state-of-the-art Ghusl table commission. We've had fabric companies who have sourced us the coffin material. We've had, you know, businesses and charities who've given us PPE. It's just been no end, you know, where it's not just been one person. You know, if we look at the grave, they need a nameplate, a temporary nameplate. So we have one guy who actually makes us the nameplate, and we have another guy who gives us the sticks, and we have another guy who gives us the screws. Wow. So it's been like everyone's been taking part. It's not just one person taking all the credit. You know, the whole community has got together, you know, and just somebody saying, you lot are doing a brilliant job, to the volunteers, thanking them, it goes a long way. And, you know, even the gravediggers, you know, the staff at the cemetery, they have been amazing in terms of, you know, working with the volunteers, with the community. And, you know, I just want to say publicly as well, you know, maybe sometimes it can look like, you know, we're taking over. We're not. We're just there to assist, because when you normally have 300, now to go to 15, there's people, they turn up and they don't know what to do. But this team was there to assist families, to, you know, ensure that we carry out you know, the last rites in the way that they should be, in a nice and dignified way, because there have been times where, you know, when people haven't listened, they've not taken instructions, they've dropped bodies into the grave. Mm-hmm. So, you know, this team was there to ensure that we give that final, you know, the end, or in this world, but not the end, but the end, you know, time in this world in the right and dignified manner. But it's been a community effort, and it goes to prove that if we come together, putting all our differences aside, you know, for a purpose, not looking at whose it is, whose ghusl, whose burial, just come together. We need to do it. He's a Muslim. We can achieve so much.
I agree with that. And you know, you know how I feel about that, Kasu, on a million different fronts. But from me here, we're running into the last minute now. From me personally, and if I have to speak on behalf of the community, you know, we are absolutely indebted to the work that this group and all the volunteers are doing, because this is a thankless task, as you say. You know, if people can just make their du'as and put them in your direction, you know, you're taking a lot of pain and suffering away from families in a very difficult time. You know, so thank you for all that you do, all your volunteers, all your teams on behalf of the community. It's some great work. And if anybody's got any ideas of how we can do something with this group of volunteers after the lockdown and Ramadan's finished, get in touch with me personally, because I'm really keen to make sure that we show our appreciation as a community. Thank you for coming, Nafisa, Imran, Ahmed, as always. Jazakallah. And keep up the good work. And may Allah reward all of you for everything that you're doing. Assalamu alaikum.
Wa alaikum assalam wa rahmatullah.